Hello students, today we will be seeing about the liver specimen. All of you know that the liver is the largest gland in our body. So first thing, you have to hold the liver in the anatomical position. So how will you keep it in the anatomical position? To know that, you should know the quadrants that the liver will occupy in the abdominal cavity. So the liver will occupy the right hypochondrium, the epigastrium and the left hypochondrium. So this is how you have to hold it. Okay, so you will keep it on your right palm and you will explain to the examiner. So first it occupies the right hypochondrium, the epigastrium and the left hypochondrium. Now what are the lobes of the liver? It is divided into the, anatomically it is divided into the right lobe and the left lobe by this peritoneal ligament which is called as the falciform ligament. So this is the falciform ligament, which is a sickle shaped fold which will attach the liver to the diaphragm and the anterior abdominal wall up to the umbilicus. So that is this is the falciform ligament. So you should be able to identify the falciform ligament. So these are the two lobes. So on the right side you have the larger right lobe and on the left side you have the smaller left lobe. Now coming to the surfaces and borders of the liver. So the surfaces are divided as diaphragmatic surface. This is the dome shaped diaphragmatic surface and this is the visceral surface where the organs will be related. So you have the two major surfaces are diaphragmatic and the visceral surface. This diaphragmatic surface in turn is divided into the superior surface, the right lateral surface, the anterior surface and the posterior surface. So these are the 5 surfaces of the liver. Now the relations to these surfaces. So if you take the diaphragmatic surface, okay, so this is the superior surface. So the superior surface will be related to the above you will be having the cardiac. So it will be having the cardiac impression. On the right lateral surface it will be related to the ribs. So what are the ribs related? Okay, so you have the 9, 10 and the 11 ribs and you can even see the costal impressions. Okay, so what is the aspect that you have to remember here is when you're doing a liver biopsy, you will be passing the needle between the 9th and the 10th intercostal space. So that is what you have to remember. The right lateral surface you will divide it into upper third, middle third and lower third. Upper third will be related to the lung, middle third you will have the gastrotryphematic recess and lower third it will be related to the 10th and the 11th rib. So this is the right lateral surface. The anterior surface will be related to the xiphoid process and the anterior abdominal wall muscles. So this is the anterior surface. The anterior surface will be related to the anterior abdominal wall muscles and the xiphoid process. Okay. Next coming to the posterior surface. See, this is the posterior surface. On the posterior surface mainly you can appreciate the IVC. Okay, the IVC, if the IVC is being removed, you can see the groove for the IVC. Once the inferior vena cava is removed, you can see the groove for the inferior vena cava. On the posterior surface, you can appreciate the groove for the IVC. You can also see a part of the caudate lobe and also the bare area of the liver. I'll come to these structures shortly. So these are the surfaces, divisions of the diaphragmatic surface. The next important surface is about the visceral surface. So this is the visceral surface. Okay, so this is the visceral surface of the liver and this is the sharp inferior border. So this is the sharp inferior border where you have 2 notches. One notch here you can see, this is for the ligamentum teres hepatis. So if they tie like this, you should identify it as ligamentum teres hepatis, which is a remnant of left umbilical vein. So you are having this is the ligamentum teres hepatis. Next, the another notch on the inferior border is for the fundus of gallbladder, which is at the level of tip of 9th costal cartilage. So this is the gallbladder you can identify. Now what are the other relations to the visceral surface? So the most important thing that you have to remember is on the visceral surface here, you can see here, this is the porta hepatis. It is a gateway of the liver where structures will enter and leave the liver. So what are the structures that are entering? Entering are the hepatic artery and the portal vein. What are the structures leaving are the two hepatic ducts. The hepatic ducts will join with the cystic duct to form the common bile duct. So what the structures leaving will be the right and left hepatic duct, which will join with the cystic duct to form the common bile duct. Structures entering will be the hepatic artery and the portal vein. So if they pin over here, you should identify it as the porta hepatis. Okay. Now, what are the other structures present on the visceral surface? If you can appreciate here, you can see two lobes. Okay. So, the lobe close to the gallbladder, always remember the lobe close to the gallbladder, and it is quadrangular in shape, that is called as the quadrate lobe. Okay. The quadrate lobe will be bounded by the gallbladder on the right side, and on the left you will be having the ligamentum teres hepatis. The caudate lobe, this lobe which you are seeing, this is the caudate lobe. This will be related to the groove for the IVC or the inferior vena cava on the right side, and on the left side you can see this ligament, this is ligamentum venosum. So if they tie any ligament which is closely associated here with the inferior vena cava, closely associated with the caudate lobe, this is the ligamentum venosum. What is this? This is a remnant of the obliterated part of ductus venosus. In the embryological life, it will shunt the left branch of the portal vein directly into the IVC. So this is ligamentum venosum, remnant of ductus venosus. It will be in close relation to the caudate lobe. So this is the fissure for the ligamentum venosum. So sometimes they can even probe like this and ask, identify the probed fissure and name the structure lodged in it. So you will say this is the fissure for ligamentum venosum, structure lodged is ligamentum venosum. So we saw about the quadrate lobe, the fossa for the gallbladder, the porta hepatis and the caudate lobe. The quadrate lobe and the caudate lobe both are functionally related to the left lobe of the liver. Okay, so now coming to the impressions of the organs. So on the left lobe, if you see, this impression is for the gastric impression. So this is the gastric impression. Over here you will have the stomach, it will continue as the pylorus. So you will have the pylorus of the stomach, and then here you will be having the duodenal impression. So the stomach, it becomes up, it goes to the pylorus, then you will have the second part of the duodenum. Onto the right lobe of the liver, the relation will be colic impression over here, colic impression and the right renal impression. So these are the impressions on the visceral surface of the liver that you are expected to know. Okay. Now, in the peritoneal relations, coming to the peritoneal relations of the liver, I already told you about the falciform ligament. Now this is the falciform ligament. This falciform ligament will divide into the coronary ligament, that is the coronary ligament. Okay, so this is the coronary ligament which will have two layers, the upper layer and the inferior layer. So the upper layer and the inferior layer on the right lobe at the end, it will fuse to form the right triangular ligament. You can't appreciate it well here, which will attach the liver to the right side of the diaphragm. Similarly, on the left side you will be having the left triangular ligament which will attach the left lobe of the liver to the diaphragm. So the coronary ligament has two layers, the superior layer and the inferior layer, which will be actually enclosing on the posterior surface the bare area of the liver. This is the bare area of the liver. This is on the posterior surface. You can identify it with the IVC. Groove of the IVC will be to the left. So this is the groove of the IVC. Superiorly, the bare area of the liver will be bounded by the superior layer of the coronary ligament, inferiorly by the inferior layer of the coronary ligament, and on the right side by the right triangular ligament. And then you have the, on the left you will be having the groove for the IVC, lodging in that will be the inferior vena cava. So this area also can be pinned, and they will ask you what is the clinical importance. The clinical importance is it is a site of portocaval anastomosis where the liver directly comes in contact with the diaphragm. So this is the bare area of the liver. What are the other bare areas of the liver? The other bare areas are, if we remove the inferior vena cava, the groove for IVC, if we remove the gallbladder, the groove, that is the fossa for the gallbladder, and also the porta hepatis. All these are the areas where the peritoneum reflection is not there. Okay, so these are the bare areas of the liver that and you are supposed to remember. So with that we will finish the liver.